Treating the transgender patient with acne is something that's been in the news a lot lately. Transfeminine patients who are transitioning to a female phenotype are relatively easy. They're being given spironolactone and estrogen in order to help with their transition, and both of those drugs are really good at treating acne. It's the transmasculine patients who are being given testosterone who are our challenge. Within 4 to 6 months after starting testosterone, 88% of them are going to end up with acne, often quite severe, and it continues to build over about the next 2 years, and then finally stabilizes a little bit, much as a teenage boy would stabilize about 2 years into puberty. So the treatment is a little bit tricky because we can't use spironolactone, we can't use birth control pills because they thwart the effects of the testosterone. Isotretinoin works really well, but the iPledge program was really not intended for patients going through the transition who are identifying when they start as a female and then switching midstream into identifying as male. So fortunately, the last couple of years, the iPledge program has gotten with the program and with the rest of the world and has taken out those questions that were uncomfortable for our transmasculine patients. But now it's time for us to do the same. What we really need to know when we're seeing our patients is who they're having sex with and how they're having sex. And these questions can get really specific and sometimes a little uncomfortable for the patient, but sometimes uncomfortable for the physician as well. But there is a publication that came out recently talking about treating acne in the transmasculine patient, and in there was a checklist for physicians on questions to ask their patients to help to determine whether or not we need to be completely worried about the possibility of them becoming pregnant while on isotretinoin. And it asks all of the difficult questions so it doesn't have to actually be verbalized by either the patient or the physician. So I strongly recommend that you take a look at that checklist and incorporate it into perhaps your review of systems when you're taking care of a transmasculine patient.